Megan, one of the spine surgery nurses here at WashU. We've put together this series of videos to help prepare patients for their upcoming spine surgery. And today we're going to be talking about nutrition and its important role in spine surgery and healing. There is no right nutrition or diet that's perfect for everybody. So make sure that you talk to your primary care doctor before making any major dietary changes. So, what is malnutrition? People tend to think that malnutrition is the picture at the top. The children in underprivileged countries that don't get enough nutrition. And that is, but nutrition is any disorder of nutrition is malnutrition. That includes deficiency or excess of nutrients, including obesity, being underweight, being protein or vitamin deficient. So it can be the picture at the top of that little baby, but it can also be the older person whose appetite has decreased or who has difficulty feeding themselves. It can be a young person with obesity. It can be a lot of different things that we don't necessarily think of every day as malnutrition. And why do we worry about that in the setting of a spine surgery? Well, it can lead to complications and bad outcomes. So, patients who are malnourished have an increased risk of postoperative wound infections, delayed or difficult wound healing, which could include a dehiscence where the incision opens up. It can increase the risk of non surgical infections, mostly urinary tract infections in patients, increased length of hospital stay, increased risk of blood clots, and those blood clots can break off from a leg or an arm and travel to the lungs and could potentially be fatal. Rapid weight loss can lead to increased nutritional deficiencies. So, we're going to talk about weight loss in a little bit here. And then the other thing is that post operative catabolism exacerbates deficiencies. And that's a fancy way of saying that if you're already low in something, after surgery, your body is going to be using extra calories and extra nutrients to heal from the trauma of having had the surgery. And if you're already low in those things, that postoperative hypermetabolism is going to make those things worse. So that can also be a problem for patients that are already deficient. Let's talk about a few specific nutritional and conditions. So diabetes, whether you're type 1 or type 2, diabetic patients have a higher risk of surgical complications and they're going to require good glucose control. So, in the orthopedic spine division, we use an A1C guideline for our elective surgery patients of it being below 7.5. So, it needs to be 7.4 or lower. And the reason for that is that we have seen in the data and in the research that 7.5 is the point at which the complications increase. So we want patients to have good glucose control. If your A1C is 7.5 or higher, you may need to reschedule your surgery. That's obviously done on a case-by-case basis, and you need to work with your surgeon on that. So to have good glucose control, we're going to aim for a fasting glucose levels under 140. We're going to aim for our after meal glucose to be 180 or less. You might need to talk to your primary care doctor or your endocrinologist about changes to your regimen to get you to that point. And the thing to keep in mind is that having too low of glucose is also a problem. We want to avoid hypoglycemia, and especially in postoperative patients, extended hypoglycemia or too tight glucose control can have just as bad of outcomes as not having enough control. So it's important that you monitor your sugars regularly. You may need to monitor them more frequently than what you would normally do to make sure that we're kind of staying in this good range and that we're not increasing the risk of complications for surgery. Those risks are especially high in terms of wound issues. So delayed wound healing, infection, it raises your risk of stroke, raises your risk of urinary tract infections, all of these kind of things that can turn out to be a major problem for patients. Obesity is also a major problem for our patients. So the definition of obesity is a BMI that's higher than 30. And a BMI is calculated based off your height and weight. Our guidelines for BMI are that we do not perform elective surgery on patients with a BMI that is over 40. So 40 is our cutoff. Again, a case-by-case basis. There may be some surgeons that are a little bit lower than that. And there may be some situations in which we would do it in somebody who's higher, but you need to work with your surgeon's office and talk to them about your BMI if you are close to that 40 range. And again, we're not doing it to be mean, but there are risks to having surgery in the setting of obesity with a BMI over 40. So those risks include longer surgical times. The longer the surgery is, the higher the risk of complications, including delayed wound healing again, infection, impaired mobility, and decreased patient outcomes. So patients just may not be as happy with their surgery if it's performed in patients who are over the BMI cutoff of 40, again, because of all of these risks of complications and the decreased mobility. Weight loss. So a lot of patients want to lose weight before spine surgery, especially if you're overweight or obese. That's great. Um, but we need to approach that with a modicum of caution as well. So weight loss happens because we use more calories than what we're taking in. So there are benefits to weight loss. It improves back and leg pain in patients before surgery. It decreases the surgical risks that are associated with obesity and being overweight, and it improves the recovery. But it's got to be done in a good and sensible way, because too rapid of weight loss is going to lead to malnutrition. It's going to lead to those nutritional deficiencies, and that's going to increase the risk of surgery as well. So we need to make sure that it's done in a way that does not deprive the body of essential nutrients, that's balanced, that's sustainable. So aiming for no more than 1 to 2 pounds per week, and doing it again in a way that we're using good nutrition as our guide and increasing our activity and making healthier food choices. So it's not doing a crash diet and trying to lose 20 pounds in a week or two. Some programs that are out there, Weight Watchers is a good one for most people. Doing a low carb diet. MyFitnessPal is a free app that allows you to track your food and your intake, and it gives you projections on where you should be based on the amount of weight that you want to lose per week. Again, shooting for that 1 to 2 pounds. So the most important part of weight loss is to do it if you need it, but to do it in a way that's not going to put you at risk of increased nutritional deficiencies. So what are our recommendations? So for all of our patients, regardless of health status, we recommend a balanced diet high in lean proteins and plant-based foods, lower in processed carbs and saturated fats. So what we recommend is that half of your plate be fruits and vegetables. Most patients in terms of protein should aim for about 20 to 30 grams of protein at each meal. So 20 to 30 grams of protein, some examples of that: a standard 3 to 4 ounce chicken breast, a 4 ounce beef patty, 5 hard boiled eggs. They have about 6 grams of protein each. For vegetarian patients, you can get those from cottage cheese, 2% cottage cheese. A cup of it has 30 grams of protein. Beans, lentils, all of those things, typically about 6 grams of protein per half cup. A cup and a half of silken tofu, or really any kind of tofu, is going to get you that 30 grams of protein. So it kind of gives you an example of what to aim for at each meal here. The other thing that we recommend for all patients is adequate calcium and vitamin D intake. So calcium, most patients should be shooting for about, that are under, women under the age of 50 and men that are under 70 should be shooting for about 1,000 milligrams daily. If you are a woman over the age of 50 or a man over the age of 70, then we're going to recommend shooting for 1,200 milligrams. And that should come mostly from your diet. So, milk and dairy products, a lot of green leafy vegetables have calcium in them. So just making sure that we're getting there as close as we can with diet, and then using supplementation if needed. Not everybody needs a dietary supplement of calcium, but you should be making sure that you're at a minimum of that 1,000 milligrams if you're a woman under 50 and a man under 70. If you're above those ages, 1,200 milligrams per day. Vitamin D. So the recommendation is about 1,000 international units per day. And it's hard to get this from food. Some foods are fortified with vitamin D, but typically not enough to get patients to that 1,000 international units. Patients also think, well, I can get this from sunlight. You can, but most patients still aren't going to reach that recommended daily dose. And if you're using sunscreen, which you should be, it's not going to absorb properly to get that vitamin D level. So most patients do require supplementation for this. If you're deficient in this at the time of surgery, depending on what surgery you're having, you may be given a weekly supplement to take, a prescription of high dose vitamin D to help boost you up, and then over the counter vitamin D and management by your primary care doctor after that. For our high risk patients, those are that are malnourished, that are diabetic, for our cancer and tumor patients, those that are obese, we may need to consider additional supplementation for those patients. So this is what's called immunonutrition. It's kind of a big thing that's being researched these days. And what we see is that when we give additional supplements like omega-3 fatty acids, arginine, glutamine, and nucleotides, that it decreases the chance of wound complications. These products are available over the counter. You can buy them at places like Amazon. Impact is one of them. Ensure Surgery, Juven for wound healing. All of these things are basically, kind of similar. So the goal would be to do 500 to 1,000 milliliters per day for 5 to 7 days prior to surgery, and then also doing it for 5 to 7 days after surgery, especially if patients are extremely malnourished. And then we want to make sure that we're optimizing the other issues. So, that we are doing weight loss if needed, that we have good glucose control, that if patients are on chemotherapy, that we're doing what we can to increase their appetite and decrease their nausea and vomiting, those kinds of things. And then for high risk patients, we also need to consider referral to a dietitian, because this video and our advice may not be enough to get you where you need to be to safely have this surgery. So if you're worried about your nutritional status, you need to reach out to your surgeon's office and let them know. In terms of that, we have some great programs here at WashU that can be very helpful for nutrition. So if you've watched the other videos, you've heard me mention the Living Well Center run by the Department of Orthopedics, and they have a registered dietitian there who can make recommendations, can make specific meal plans with you. They're a great resource for diet nutrition concerns. And you can find more information about the Living Well Center at our website, ortho.wistal.edu. For patients that are obese or needing to lose weight and have not been successful with diet and exercise alone, there's a couple of options. Here at WashU, we do have a Department of Bariatric Surgery, and there's also a medical weight loss clinic. So those things can be helpful for patients that have a lot of weight to lose or that aren't able to get that BMI down into the surgical range on their own after trying diet and exercise. There's also registered dietitians here outside of the Living Well Center, so you can talk to your surgeon about that. Or your primary care physician is your best resource for advice about diet nutrition, because they know your health history, they know the various conditions that you may have, and they're going to have local resources in your community that are available to help you for that. So that's our talk today on diet and nutrition. I hope that you enjoyed this video, and please reach out to your surgeon's office or staff if you have any questions. Thanks and have a great day.